Chapter 10. Primary Care. The National Health Service is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as a cervical collar with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPS, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPS work in practice of 1 to 20 practice. 1 to 20, sorry. Practice are based in surgery and look after the health from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vacations, for example, for influenza, and may perform minor surgery, such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours treatment for 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPS and locums GPS to cover if someone absent. Note: the non-surgery has three meaning: the building where GPS work, a time when GPS see patients, the work of surgeons. The practice team. A typical GP practice employs receptionists. They are responsible for initial patients contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other health care providers, and for filling and scanning documents into patient records. The practice manager has responsibility for finance and sometimes for it, supervises reception staffs, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPS work with a number of health professionals. District nurse visit temporarily housebound patients, such as recently discharged hospital patients to change dressing, such as ulcer dressings. Health visitors visit families to carry out checkups on young children, particularly under 5, to make sure they're healthy. Especially attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment but also teach patients exercise they can do to improve their condition after an accident or operation. A GP's Day. Dr. Stewart worked in a practice in a small market town with three other family doctors. The surgery is in the center of the town. It is shared by three practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery. Check the OOH, email paint out. Check for urgent and not urgent measures. 8:30 a.m. Check emails from the health board and parents. Prepare for surgery. 8:30 to 10:50 a.m. Morning surgery, 10 minutes appointment, 6 pre-booked last week, 2 pre-booked 48 hours ahead, food boardable on the day. 10:50 and 10 5:55 a.m. Check with station for message signed prescriptions and deal with repeat prescription requests. 11 and 11:20 a.m. Coffee break into conference room with college. 11:20 and 11:30 a.m. Check home visit requests and divide up visit with college. 11:30 a.m. and 1 p.m. home visits. Exercise. Complete the sentences. Look at A opposite to help you. Children over 60 seconds and people with some chronic disease do not have to pay in the United Kingdom. Patients with mobility problems might be unable to go out. They are: the average GP is 10 minutes long. A is someone who takes the place of a staff member who is in on leave. Care outside working hours is known as treatment. Make word combination using a word or phrase from each box. Change, make, perform, refer, run, supervise, take. Messages, staff, appointments, home visits, dressings, a clinic, a patient, minor surgery. Which member of a practice team will be responsible for each of the following? Look at B opposite to help. Running a clinic for pregnant women, teaching a patient how to straighten his broken leg, letting the GP know that the patient can come to her appointment, running a clinic for people who want to lose weight, visiting a patient who has just returned home after a hernia operation, carrying out checkups on children in a poor neighborhood, organizing cover for absent doctor. Complete the diary for Dr. Stewart afternoon. Look at A and C opposite to help you. 1 to 2 p.m. practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon. 12:10 minutes. 4 to 4:20 coffee break. 4:20 to 5 p.m. check with blank space for message. Deal with home blank space and repeat blank space request. 5 to 6 p.m. paperwork blank space to secondary care, admit tax, telephone call to patient, private medical examinations. 6 p.m. phone switch to blank space service.